Welcome to UMCC Medical Consulate and Connectors, where your health matters to us. Bronchial carcinoma, also known as lung cancer, is a serious disease. It affects the lungs, which are essential for breathing. This happens when cells in the bronchi, the airways of the lungs, grow uncontrollably. There are two main types: small cell lung cancer and non-small cell lung cancer. Understanding the difference is important as it affects treatment decisions. This disease is a major health concern worldwide. Sadly, it is a leading cause of cancer-related deaths. Early detection is crucial for better treatment outcomes. If you experience any unusual symptoms, consult a doctor immediately. Smoking is the primary cause of bronchial carcinoma. The act of smoking introduces numerous toxic substances directly into the lungs. Cigarette smoke contains many harmful chemicals including tar, nicotine, and carbon monoxide. These chemicals damage the cells in the lungs over time, leading to cancer. The continuous exposure to these toxins causes mutations in the lung cells. Exposure to radon gas is another significant risk factor. Radon is a colorless, odorless radioactive gas. This radioactive gas is naturally found in soil and rocks. It can accumulate in homes, especially in basements and lower levels. It can seep into homes and buildings, posing a risk to those exposed over long periods. Regular testing for radon levels is crucial for safety. Other risk factors include air pollution, asbestos exposure, and family history. Industrial pollutants and asbestos fibers are particularly dangerous. People exposed to these carcinogens are at an increased risk. Protective measures and regulations are essential to reduce exposure. It's important to minimize exposure to these risk factors. Simple actions like wearing masks and sealing home cracks can make a difference. While not everyone exposed will develop lung cancer, reducing exposure significantly lowers the risk. Leading a healthy lifestyle and taking preventive measures can help protect your lungs. Bronchial carcinoma often doesn't show symptoms in its early stages. As the disease progresses, individuals may experience persistent coughing. Chest pain is another common symptom. This pain may worsen with deep breaths or coughing. It's crucial not to ignore persistent chest pain. Shortness of breath is a warning sign. This can occur even with minimal exertion, like climbing stairs. If you experience this, seek medical attention. Other symptoms include wheezing, hoarseness, and coughing up blood. Unexplained weight loss and fatigue can also be indicative of the disease. Section 4. Diagnosing bronchial carcinoma. Diagnosing bronchial carcinoma involves various tests to accurately identify the presence and extent of the disease. A chest X-ray is often the first step in the diagnostic process. It helps visualize the lungs and identify any abnormalities, such as unusual masses or nodules. If the X-ray shows suspicious areas, further investigation is necessary to determine the nature of these findings. A CT scan provides a more detailed image of the lungs, revealing tumors and other abnormalities that might not be visible on an X-ray. A biopsy is crucial for confirming the diagnosis of bronchial carcinoma. This procedure involves taking a small tissue sample from the lungs for examination under a microscope to identify cancer cells. Other tests, such as bronchoscopy, may be performed to get a closer look at the airways. This involves inserting a thin, lighted tube into the airways to visualize them and collect tissue samples, providing a comprehensive view of the lung's interior. Section 5. Preventing bronchial carcinoma. The most effective way to prevent bronchial carcinoma is to avoid smoking. Quitting smoking significantly reduces the risk of developing this disease. Minimizing exposure to radon is crucial. Testing homes for radon levels and taking steps to reduce high levels can lower the risk. Protecting yourself from air pollution is important. Avoiding areas with high pollution levels and wearing masks in polluted environments can help. Maintaining a healthy lifestyle is beneficial. Eating a balanced diet, exercising regularly, and getting enough sleep can boost overall health. Section 6. Treatment options for bronchial carcinoma. Treatment for bronchial carcinoma depends on various factors, including the type and stage of the cancer, as well as the patient's overall health and medical history. These factors help doctors determine the most effective treatment plan tailored to each individual patient. Surgery is a common treatment option for bronchial carcinoma. It involves removing the cancerous part of the lung and sometimes nearby lymph nodes to prevent the spread of cancer. This is typically an option for early-stage lung cancer, where the tumor is localized and has not spread extensively. Chemotherapy uses powerful drugs to kill cancer cells throughout the body. It can be used before surgery to shrink tumors or after surgery to target any remaining cancer cells that may have spread. Radiation therapy uses high-energy rays to destroy cancer cells and shrink tumors. It can be used alone or in combination with other treatments, such as surgery or chemotherapy, to enhance effectiveness. Targeted therapy uses drugs that specifically target cancer cells, minimizing damage to normal cells. Immunotherapy helps the body's immune system recognize and fight cancer cells more effectively, offering a promising option for some patients. MCC, your ultimate medical consultant connectors.